Yes, I think preparation is very important. Certain thing which we think would certainly help, that if you smoke, if you can stop smoking. I always advise people to stop smoking before a general anesthesia. Now, there is not a very strong evidence, but we feel that if you stop smoking for 6 weeks, your chest will be much better and your risk of chest infection is less. Similarly, weight reduction is if you are overweight, like if someone's BMI is above 30, or they are even above 25. If you work on reducing weight, it will improve the general health of the patient, and general health improvement will reduce the risk of operation. So these are two things which is very important. Again, a week before operation, it is better to avoid excessive alcohol and indulgence, because obviously body need to be in best form. We do pre-op checkup, and so if there is any disease condition that patient have, like diabetes or blood pressure, they need to be controlled. So if obviously once the patient come and see me, we check all these things, and if anything is not under control, then that have to be brought to control before the operation. So that would be done as a part of the process. One of the things, we are very good in managing that side, but the part that means reducing weight, stopping smoking, and general health improvement is not easy. But I always try and see if it is possible to do that. So these are the things that we should be always concentrating, and it's good for long-term health of patient anyway. So that's one of the things we should be putting a stress on. So yes, keyhole surgery, although it is less invasive, it still carries potential significant risk. So we always make sure that we take all effort to reduce the risk. The risks are infection, any bleeding, any injury to any structure during the operation. Now, that is the technical part of the operation, and that's why we have got very good system in this country, that surgeons are trained very well, and we've got a very, very low risk of any potential injury happening. But still, there are potentials. So we always warn patient about that. The other risks are like DVT, chest infection, pulmonary embolism, and all these we have to take into account. And in patient where there is excessive risk, we make effort to reduce the risk before the operation. There is a risk of recurrence with the operation, with hernia operation. The risk of recurrence of hernia operation went down since we started using mesh, and both for open operation and for keyhole operation, it is less than 1%. In my own practice, I think the risk is much lower, but still there is potential risk of recurrence, and I always inform patient about that. So keyhole hernia surgery, patient is done in majority of cases. Patient can have the day case facilities, then to have the operation as day case. So they go home same day, you are up and about soon after operation, and one of the most important things is, which I tell the patient, that make sure you are mobile. You're not spending time, even if you have got some discomfort, you must move about. There's no restriction after the operation except for lifting heavy weight, which again, most of the time people can do within 4 weeks. So most important activity is to be active and be up and about. Recovery is quick, and you can get back to non-strenuous work within a couple of weeks of the operation. Of course, if there is any complications that have to be managed, but if there is no complication, most of the patients are recovered very quickly. For keyhole and in open hernia surgery as well, I always encourage patient to be active after the operation. So get up, take painkiller if you need, but be mobile. Now, I advise people not to drive during the first week because you may not be covered from insurance point of view if you are involved in any accident. So not to drive during the first week. If second week, if the pain is not an issue, I think driving is fine. For all other work, except for strenuous work, once the pain allows, I say you could do that. Walking, jogging can start within a week of the operation. But again, you have to take into account that operations has got pain, a little bit discomfort. So everything to start slowly. I say to the patient, there's not restriction, but you have to listen to your body and start slowly and make sure you make an effort to do the activity that you want to do.